Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to our live health show coming to you directly and live from the Bradford Iqra TV Al Khair studios. Alhamdulillah. Before the break, we were discussing the issues and the research of Professor Roy Taylor, the Professor of Medicine and Metabolism at Newcastle University. And we mentioned at that point that the professor came after painstaking research to the conclusion that diabetes is not caused by obesity. However, it's caused by when a person kind of breaches his individual fat threshold, i.e. he breaches the level at which point the body can't store the fat in his body in the fat cells, rather it will store them inside and on and around the liver and the pancreas. Okay, now this is the professor's research, which has now complete backing from all the expert endocrinologists and the experts of diabetes in the United Kingdom. Europe and America are far away, and obviously they take a lot more time to be convinced for whatever reason. And to understand that, there's GPs in the UK, many GPs who don't know this advice that Professor Roy Taylor and other eminent professors of diabetes have proven to show that diabetes can be reversed permanently and is eminently curable. And now, inshallah, I'll explain to you how he proposes you do so. And he says, people who have got diabetes or been diagnosed with type 2 diabetes over 6 years ago, within 6 years, there's a 90% chance that you can reverse your diabetes. And thousands of individuals up and down the country, different BMIs, different levels of being fat, have reversed it. Subhanallah. Now, before I actually go into this and explain to you what he proposes, and then explain that in Urdu, I just want to answer the question one of the sisters rang in about. And the question was, the sister was asking that how come many young girls nowadays, and you'll realize this, are complaining of peak polycystic ovary syndrome, yeah, or early menopause. Very, very weird, because going in the 80s, this you wouldn't even hear about diabetes, to be honest with you. Never mind cancer. Cancer was at that point was 1 in 750. Now it's 1 in 2. We've got a call waiting. Let's get the call and then we'll come back to this question, inshallah. Assalamu alaikum wa rahmatullah.
Wa alaikum salam, sir. I won't keep you too long. I just want to thank you. I'm very, very much obliged, and I wish there were more people like you who are telling us the truth, and such a pious person. The question that you answered about anxiety, stress, and what was the other one? Depression last week. Depression. I mean, diabetes. Sare log mujhe ko nahi khai pili gani. Pata nahi kya koi. I don't know what it is. We are lack of education.
Huh.
Now I wish more people would, watch your program and listen and learn.
Jazakallah.
Thank you, sir. Both of them.
Jazakallah bhai. Nice and sweet. Thank you very much for such nice words, mashallah. Jazakallah. ये तो हमें से बड़ी खुशी हमें होती है. People appreciate this, alhamdulillah. And this is the reason our teacher, Zaman Abdurrahim Sahib, Allah give him a long life. This is what he says, just benefit people, and that's what we're here to do. Alhamdulillah, it breaks our hearts every time somebody has, issues with diabetes and complications, and you have massive complications of diabetes. I mentioned this a few times before. Diabetic nephropathy, neuropathy, retinopathy, aankhon ka kharab hona, kidneys ka kharab hona. Kidneys ka kharab hona, you don't want to wish that on your worst enemy. It's so, it's terrible. Kidneys, when the kidneys go. You have 5 levels of kidneys, okay? Stage 5 kidney disease, stage 4, 3, 2, 1. It's so bad. In stage 3, you have complications. Never mind stage 1 and 2 when you have dialysis. So diabetes is very, very serious, and there's so much you can do for reversing diabetes. So I just want to explain that diabetes, it can be easily reversed. And the first thing I think you should do is just get a copy of this book. About £7 I think I paid for this. Professor Roy Taylor, Simple Guide to Reversing Type 2 Diabetes. Even those of you who don't have diabetes, get this book. Why? I'll explain to you in detail. I don't have the time. I've only got 30 minutes left. because this book will explain to you everything, and inshallah, and I'll explain to you as well what is mentioned in a nutshell. But before this brother called in, Allah reward him for his kind words, I want to explain to you the answer to the lady who called earlier on about why people get polycystic ovary syndrome. Polycystic ovary syndrome, medical science will say that it's a disease of unknown origin. Maybe it's genetic, we don't know. There may be a family history of it, but they don't really know why you get it. The symptoms of polycystic ovary syndrome are very easy: delayed menses, irregular periods, heavy periods, painful periods, alongside issues like acne. You may have acne, you may have hair loss. You even may have infertility because of polycystic ovaries. You get cysts basically on the ovaries. You have two ovaries, the right and left. The way that males have testicles, females have ovaries that produce the female hormones. So उनके ऊपर you get small cysts, just नहीं होते ना, you get small spots, but they're filled with cysts, and sometimes they get big, centimeters big. We had a patient, hers were 3.5 centimeters, काफी बड़े थे. So, and they are, homeopaths around the world will state that they are, very, very well treatable with homeopathic medicine, alhamdulillah. So the reason why you get this, first of all, it's an explosion of, lack of exercise. Few reasons that I see in clinical practice, I'll tell you a few. The first thing is lack of exercise. Our young teenagers don't exercise. Sedentary lifestyle, they stay at home. Kuch karte nahi pate. In the 80s, there was research in 1980 seeing the way of people. Now, let me explain to you how much difference has, how fat people have become. In 1980, how many people had a BMI of over 30, i.e. who were obese? Not the Asians, the ethnic white people, yeah? Europeans. How many of them guys were obese? Obese meaning over 30, over 29.5 BMI. 1 in 7 was obese in the 1980s. If you see pictures of 1980s, you see everybody slim. Very shaz, not there, very rare you'll see somebody who's obese, physically obese, not visceral fat that you can't see inside the organs, but physically. So in 1980s, everybody, 1 in 7 people, 1 in 14, 7%. 7% of the UK population was obese. They had a BMI of over 29.5, over 30. 1 in 14, 7%. In 2021, how much they were? 31 years later, 2012. So 80, 90 and 2012. So 32 years later, guess what the obesity stats were then? In 32 years, instead of being 1 in every 14, it became 1 in every 4. So instead of 7% of the population becoming obese, it was 25%. Such a huge rise. Now, obviously, in the 80s, as I mentioned, you would very rarely hear people with, diabetes even. It was rare. Even asthma was rare. Autism was rare. So many things were rare. Cancer was definitely rare. It was 1 in 750. Suddenly, in 32 years, and you can correlate this with ill health, fat, fatness, being fat, and more than being obese is the right term, the sugar. Ooh. If you want to read about sugar, Dr. Asim Al-Hotra sends about sugar, is an expert. Sugar is the culprit. Sugar is causing an explosion of obesity, it's causing an explosion of ill health. Sugar in the blood, diabetes. Sugar in the brain, Alzheimer's, dementia. Sugar in the dil ke andar you get, heart disease. So this is one of the reasons why, one of the theories behind why so many girls, young girls, teenage girls, early adults are getting polycystic ovary syndromes. Okay? Polycystic ovary syndrome. So sedentary lifestyle, not exercising. And the second and third thing I want to mention is that, so many things ladies use, yeah, certain things they use for, birth control can cause an amazing, dichotomy in their hormones. Yeah, it causes like a craze in their hormones, imbalance. And the third thing, and this is very important, is chickens. As I mentioned some months ago about farm fish and how toxic it is. I want to mention something else today, and that is chickens. Do you know how many chickens people consume? Just look at these famous, famous, no, not famous chickens, famous brand where you go and buy burgers, begins with M. How many chickens do these guys use daily to make your, chicken haram? Yeah, haram chicken sandwich. Let's be honest. They use it's a staggering amount of chickens. Now they don't have time to let these chickens, walk around and enjoy lazily the sunshine and the nice organic feed. They haven't got time for that. So they'll inject them with estrogens and other hormones, androgens, the female sex hormones. They'll inject them with that. And guess what? In 3 weeks, that chicken is like a 3-year-old. And off they go to the slaughterhouse. And, our brothers and sisters go in, and they order this chicken burger, whatever they order, whatever they eat. And them hormones inside that chicken, where do you think they're going to go? They're not going to fly out of somebody. No, they're going to stay in your system and they're going to cause havoc with your, female gynae. And one of them, havocs, is polycystic ovary syndrome. It's an explosion. So the first thing people should do if they have polycystic ovary syndrome is stop these chickens, go for organic, go for free-range chicken, number one. Number two, exercise is very important, very, very important for everybody. And inshallah, next week, hopefully, we'll have a special guest, Yannick Mizepo, just to tell us tips on what we should do at home to, and research says that just 30 seconds of high, threshold where you reach, your heart's kind of 95% maximum rate of exercise for 30 seconds for a few times is enough. He shows how to do that and what exercise to do, inshallah. But until then, and alongside that, exercise, no problem. Go to the parks, with your family and exercise. Very, very important. You don't need to do it for half an hour. Do as much as you can. And homeopathic remedies for polycystic ovary syndromes, very important. The homeopathic remedies are one remedy called silica, one's called pulsatilla. These are very famous remedies for the female gynae. Pulsatilla person likes to be outside a lot, likes consolation, is very kind of, soft-spoken, can be quite, easily irritated. Pulsatilla. But again, always speak to your local homeopathic physician who can guide you, because it's not just over the counter. And the other remedy is sepia. Sepia is a lady who's very, very irritable, has delayed menses, is indifferent to her loved one. She doesn't kind of care. She's very tired, has a sinking down sensation on her kind of lower pelvic area, which is in accordance with the issues with of polycystic ovary syndrome. So try, talk to your homeopathic physician, give them a call, and they can advise you further. I want to quickly mention Professor Roy Taylor's advice for how to reverse diabetes. So he says, go on a diet of 800 calories for 2 months. 800 calories, soups, your home food, vegetables, anything you want to do, but it can't be more than 800 calories for 2 months. In these 2 months, you will lose 2.5 stones. That 2.5 stones, a lot of that will be from the internal organs. And there's only 0.5 gram in your pancreas that's causing the problem, but it won't just go by a small amount of a few pounds. It'll go after losing 2.5 stones, almost guaranteed. In 90% of the cases of people who have diabetes, if they lose 2.5 stones, and they will lose 2.5 stones on 800 calories a day for 2 months, diabetes, khud hafiz, is gone. Okay? ये कह रहा था कि ये जो प्रोफेसर रॉय टेलर जी की किताब है द सिंपल गाइड टू रिवर्सिंग टाइप 2 डायबिटीज़, इनका पूरा खुलासा यही है कि अगर डायबिटीज़ का आपको डायग्नोसिस मिला हो 6 साल के अंदर अंदर, तो आपका ये तर्ज अमल आपके लिए लाजमी है कि हर दिन आप 800 कैलोरीज़ लें। ज़ाहिर बात है मुश्किल होगा अगर किसी को पता नहीं है कि कैलोरीज़ है क्या भला, यू हैव टू डू द रिसर्च। 800 हर खाने के अंदर एक एनर्जी का हिस्सा होता है और कैलोरीज़ उसको कहते हैं कैलोरीज़। तो आपको पता करना होगा कि किन खाने के अंदर कितने कैलोरीज़ हैं और इसके मुताबिक आपको 800 से ज़्यादा कैलोरीज सुबह से लेकर शाम तक आपको नहीं खाना है। ये 2 माह तक आप करेंगे तो आपकी डायबिटीज़ अगर 6 साल के अंदर है, प्रोफेसर रॉय टेलर के दलील के मुताबिक आपकी डायबिटीज़ चली जाएगी अगर 6 साल के अंदर है। अगर 6 साल और इसके जो केस हिस्ट्रीज़ हैं 20-20 साल वाले लोग भी हैं जिनको डायबिटीज़ टाइप 2 है, उनकी डायबिटीज़ चली गई। तो हर आदमी के लिए लाजमी है जिनको डायबिटीज़ है या जिनको डायबिटीज़ का इम्कान है, उनके घर वालों के अंदर है या जेनेटिकली प्रीडिस्पोजिशन है। और जेनेटिक का मतलब ये है कि ये नहीं कि आपको लगने वाली है, मतलब ये है कि आपको ये जो थ्रेशोल्ड है ना कि जब आपके जिस्म फट सेल के अंदर फट डालना बंद कर लेता है, बाज़ों को बाद में होता है, जिनको जब उनको बहुत मोटापन होता है, बाज़ों को जल्दी होता है। तो अगर आप जेनेटिकली ससेप्टेबल टू डायबिटीज़ हैं, तो इसका मतलब ये है कि आपको ये जो मरहला है, आपको वहाँ आप जल्दी पहुँच जाएंगे वहाँ। यू विल रीच दिस थ्रेशोल्ड quicker than anybody else. So if you are in that position, you should definitely start this 800 calories every single day for 2 months, and inshallah you will lose 2.5 stones. It's easier to do a diet for 2 months than forever and ever. You lose 2.5 stones, your diabetes will go, your liver will be back to normal, your pancreas will go back to normal inshallah very very soon after this diet, and you'll be normal. Then going forward, what do? जब ये आपका हाल हो गया आप और ये ट्राई कर देखें, ये बल्कि किताब देखें, आप इसको गूगल भी कर सकते हैं। प्रोफेसर रॉय टेलर कोई आम आदमी नहीं है, बड़े बड़े मर्तबे के तबीब हैं, प्रोफेसर हैं, मेडिसिन और मेटाबॉलिज्म के न्यूकासल यूनिवर्सिटी के पुरानी रिसर्चर हैं। आपकी जीबी से बात करें कि हवाले दें, उनको पूछें। मैंने कहा था, it takes a long time for research to reach public health and to your GP for whatever reason. This is the reason why even the Europeans and Americans इसके बारे में वो अभी यानी सोए हुए हैं. They don't know about this. But if you've got diabetes, you want to get rid of it, and this is the most best and safest way of losing your diabetes type 2 for good. So when you go to your GP, he says lose weight, lose weight, lose weight, but he doesn't sound convinced, and you're not convinced, so you leave it. This professor is telling you your diabetes will go, especially if it's within 6 years diagnosis. Especially if it's within 2 years, it'll go. 6 years it'll go, and that's a 90% chance of that. All you need to do is 800 calories every single day. हर दिन 800 कैलोरी आप लें 2 माह तक. 2 माह के अंदर आपका 2.5 स्टोन चला जाएगा. आपका फिर इंशाल्लाह डायबिटीज भी चल जाएगी. और इसके बाद आपको क्या करना है कि 3/4 हिस्से आपके कैलोरीज खाने हैं. अगर आप हर दिन पहले 2000 लेते थे तो अभी आपको 1500 लेना होगा, 3 क्वार्टर्स. तो अल्लाह ताला सब मरीज़ों को शिफा अता फरमाए. अल्लाह ताला जिस तरह के मुख्तलिफ बीमारियाँ हैं, डायबिटीज़ हो गई हैं, इस तरह और दवाइयाँ बीमारियाँ सबको हिफाजत फरमाए. और अल्लाह ताला में तौफीक अता फरमाए कि ये जो रिसर्च है हमारे फ़ायदे के लिए है, इस पर अमल के तौफीक अता फरमाए. Thank you very much, and Jazakallah khair for staying with us today and giving us your valuable time. Until next week, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.